afternoon. Allegheny County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our update on the coronavirus pandemic. Certainly there's been a lot of news just in the last few days with the CDC coming out with updated recommendations and updated information on the Delta variant. The Delta variant is basically like a new virus on top of what we've been dealing with the original COVID virus over the last year and a half. And unfortunately, this virus is more contagious, spreads much more easily than the original COVID, and also is more virulent, and particularly among young people. So I think it's something, as we continue to encourage people to be vaccinated, it's something we want to continue to do. But I'm going to digress for a minute because today's a pretty big day in this region. There was an announcement that Jeffrey Romoff is retiring after many, many years, many decades of leading UPMC. And when you think about where we have come as a community with respect to health, with respect to our economic system of health that's grown up in large part because of what UPMC has done, Jeffrey Romoff is a giant in the healthcare field. I want to thank him personally and on behalf of the folks of Southwestern Pennsylvania for a lot of things that he's been able to do. And even during the pandemic, one of the things that I think has left us in a better place than other places in the country is the fact that we as a community believe our healthcare professionals. We have confidence in people like Dr. Bogan when she tells us, gives us good advice. Because of UPMC and AHN and the University of Pittsburgh Medical School, this system that's been built up over many decades is something that we've had a lot of confidence in, and it's really served us well over this last year and a half. Compare that to the pandemic of a century ago, back in 1918, the Spanish flu, in which Pittsburgh actually led the country in per capita deaths. So, a century later, we're certainly doing better, and Jeffrey Romoff deserves a lot of credit for being a big part of creating this ecosystem of folks that now we believe in and we have confidence in. As we continue down this road, we still have about that 25 or 30% of the folks that are unvaccinated, and we really worry about them because they're really putting not only themselves at risk in a big way, but also their children and the kids that they're around. The under 12 population right now cannot be vaccinated. It's not been approved by the FDA, even under emergency use. So for all those folks that we want to protect, and as parents, we do that. I don't think any of us would allow our children to get in a car, for example, without putting the seatbelts on them. Now, the seatbelts don't guarantee that nothing bad is going to happen if you get in a car wreck, but they certainly improve your chances. We would never want our kids to ride their bike without putting their bike helmet on. And I, as a parent, I speak of that knowing, worrying about my kids as they grow up. I can tell you every one of my kids has been vaccinated, and I'm proud of the fact that my wife and I have been able to convince them, and it didn't take much convincing, but we want them to be safe. But we want all children to be safe. So really all of us need to continue to encourage those that haven't been vaccinated, that not only for themselves, but for the whole community and for all of us doing the things that we're doing. We know our cases are going up. We're certainly monitoring that, and Dr. Bogan and her team have been watching those numbers very closely. We also know that the hospitalization numbers and death numbers haven't gone up yet, but we know that's a lagging indicator. So as Dr. Bogan gives her update today, she'll be filling us in on where we think things are going and where we want to make sure we can be of assistance to keep this community as healthy as we can be. So let me turn it over for Dr. Bogan to give her update. Dr. Bogan?
Thank you, County Executive. Good afternoon. Yesterday, I, like many of you, paid very close attention to the CDC's revised recommendations for COVID-19 and the Delta variant. Among the recommendations, the CDC advised that everyone, regardless of vaccination status, should wear masks in public indoor settings in regions experiencing high levels of COVID-19 transmission, and that universal indoor masking should be observed for all teachers, staff, students, and parents in all K-12 schools, again, regardless of vaccination status. My response today, as it has been throughout the pandemic, is that the best way to beat this virus is to follow the CDC recommendations, including yesterday's updates. I strongly support and recommend following their guidance on masking and other mitigation efforts, and following their advice that all eligible people should get vaccinated as soon as possible. I understand that it can be very frustrating when the CDC changes their recommendations. I understand we all want stability, we want consistency, we want our old lives back. Really, we all do. So when the CDC says masks are no longer needed if you're vaccinated, but then changes course and says they are needed in certain areas, regardless of vaccination status, it can be very discouraging. Please understand why those recommendations are changed. Because this virus is unpredictable and has the ability, even the predisposition to evolve and become more dangerous, we must adapt our behavior and our recommendations accordingly. The virus's drive to survive is every bit as strong as our own, and so variants are born. This one, the Delta variant, is much more contagious than the previous versions of the virus. The CDC recognized that threat, observed the increase in cases, and acted yesterday with the singular goal of protecting us. So how do the new recommendations apply to Allegheny County? There is no mask mandate here, but the CDC continues to recommend, and I support, that those who are not vaccinated wear masks when indoors with others. Yesterday, CDC added their recommendations that masks be worn indoors in public settings in areas with substantial or high transmission, as defined by case rate and PCR positivity, regardless of vaccine status. According to the CDC COVID tracker, Allegheny County is currently below the high transmission rate. We are in the moderate transmission zone. Our current case rate of 17 cases per 100,000 people falls in the moderate zone, which is defined as a case rate between 10 and 49 cases per 100,000 over a 7-day period. Our current positivity rate is 2.7%, which is in the low transmission zone, defined as 0 to 4.9%. However, when these two indicators, case rate and positivity rate, are in different zones, you use the higher of the two to determine your region's transmission status. So it's important also to note that our cases are certainly rising here in Allegheny County. In late June and early July, our cases were about 10 to 15 new cases a day. Now, just 3 weeks later, we're experiencing 70 to 75 new cases a day. And our case investigations continue to trace the positive tests back to small and large gatherings, mostly indoors, with no social distancing or mask wearing. Meanwhile, hospitals here and countrywide continue to report that most people who become seriously ill or die from the virus are not vaccinated. Certainly, there are some breakthrough cases in which vaccinated individuals do contract COVID, but it's clear that the virus is now primarily targeting and thriving among the unvaccinated. As for schools, I'd like to remind everyone that children under 12 are not yet eligible for COVID vaccine, and that the single best way to protect our children is for everyone who's eligible to get vaccinated. As I said, the virus is thriving mostly on the unvaccinated. They serve as fertile ground for more variants to emerge in the future. So we must work together to stop the spread of the virus. Working together means supporting people who are hesitant or skeptical, listening to people's doubts and fears, offering facts and other points of view, sharing the fact that the virus is far more dangerous than the vaccines, and perhaps offering that by getting vaccinated, not only do we protect ourselves, but we protect others around us, including children and people at risk in our own community. This is really a pivotal moment in the pandemic, the latest in many pivotal moments. The difference between this moment and previous moments is that this time we have the solution. This time we know exactly what we need to do to protect our community, The question is, are we united and brave enough to do the right thing? Thank you, be safe, and be kind.
Our first question today comes from WESA. COVID vaccination data for Allegheny County shows an uptick in people getting their first doses last week. Is this a blip, or are certain initiatives starting to have an impact? Or do you think that people are just motivated by concerns around the Delta variant?
It's really hard to speculate. All those are possibilities. Whatever the indication for the higher rates of vaccination, I'm thrilled. Again, what we really need to focus on is getting more and more people vaccinated.
Several outlets, including WESA, KDK, and the Post-Gazette, asked questions about possible mask mandates and whether the county is considering issuing mitigation rules beyond the CDC guidelines. Can you have any response to that?
I think our county executive is going to take those questions.
Several outlets, including WESA, KDK, and the Post-Gazette, asked questions about possible mask mandates and whether the county is considering issuing mitigation rules beyond CDC guidelines, and are asking for a response.
I don't think we're there yet, because again, I think the numbers, as Dr. Bogan indicated, we're in the moderate range at this point, but I think, we're going to closely monitor to see where those numbers go. The CDC has come out with their recommendations, and we think people should certainly follow those recommendations. But as far as a mandate as of yet, I don't think we're there as of yet. As most people know, the mandate ended on June 28th. There was a mandate prior to that for unvaccinated people, and the vaccinated people indoors were not required to wear a mask. But like Dr. Bogan had indicated, I know things change. The CDC, changes the recommendations, and they're changing because of what's happening on the ground, because of numbers. The science is dictating this. So we're not there yet, but again, it's stay tuned. You never know what's going to happen over the next coming weeks.
This follow-up question is from the Post-Gazette. Even if the state doesn't move to enforce a mask mandate, do you think they should?
Well, again, the state will make those determinations, and I'm sure they're looking at their numbers. And again, we're seeing numbers across the country that have gone up, I think, sixfold in the last 30 days. The state's numbers, I don't know if it's exactly that, but they're trending upwards, as well as the county numbers. Dr. Bogan does have the authority to have a mandate that would be more strict than the state. Whether, again, those numbers will dictate, as the health department reviews that and Dr. Bogan looks at that to see where they go. I think the state also, again, is monitoring where they are. The governor, I think, has indicated he doesn't want to have a mask mandate. I think he stated that yesterday. But again, as things change and things move along, those things could change.
The next question comes from WESA. More and more workplaces are bringing employees back into the office. Allegheny County is not currently deemed a location with substantial or high spread by the CDC, but if that were to change, would the county recommend that employers return to a work from home policy?
I think at this point, people should be back to the workplace. Again, you've got CDC recommendations that can make that safe. Certainly the biggest thing to make it safe is vaccines. And I know many employers are now not only encouraging them, but making it a condition of employment. I want to applaud the NFL and the Steelers, for example, for what they're done to make sure it's a condition of employment for all members of the staff, coaches, staff members to be vaccinated. We're seeing that President Biden has indicated that for federal workers, there's going to be either vaccinating as a condition of employment or constant testing that will be, probably onerous for people that are unvaccinated. Our universities are going along those similar lines. The VA has come out with mandates. So I think you're going to see more and more workplaces that want to be able to work, want to have their folks in the office, in the workplace, at the factory, in the lab, et cetera, and they may be imposing their own regulations with respect to vaccines, with respect to masks of the unvaccinated, testing of the unvaccinated, things along those lines. But we've encouraged people to get to be back into the office, to be back to work, and we will continue to do that.
The next question also comes from the Post-Gazette. Does the county know how many cases of the variants, Delta and others, are present in Allegheny County?
We don't know the number of cases for the different variants. You know, we only send a fraction of cases are sent for sequencing or typing. You know, we do have the national data, so the CDC says that more than 80 cases across the country are Delta variant. They also do it by region on their CDC webpage, and the current CDC forecast for our region, which is Region 3, for the weeks July 4th to the 17th, it looks like the Delta variant made up about 66% of the cases in our region. But again, we don't send every result for sequencing.
The next question is from WESA. What level of spread in Allegheny County does there need to be for the mask guidance to apply here?
So the CDC recommendations are that when you hit substantial spread, that is 50 to 99 cases per 100,000 in a 7-day period, or a positivity rate of 8 to less than 10%, you're in the rate that would require the mask mandate.
The next question is from the Post-Gazette. Does the county keep track of how many deaths are related to the variant? And if not, is that something that they may consider doing in the near future?
Yeah, again, similarly, we don't get sequencing on every test result, so we don't keep track. It is an interesting question, particularly around breakthrough and looking at breakthrough cases to see what variant that was, but we don't currently do that. Our county lab specifically doesn't sequence for the variant. I believe the state is starting to do that. Many of the commercial labs are doing it. There's also a challenge with timing of when tests are obtained, and then if somebody's test is done and then they've been in the hospital for a couple of weeks, the sample may not be available for sequencing. So there's lots of challenges to that. It is an interesting idea and concept, but it's not currently happening, and it's not currently planned, at least at the county level.
The next and final question is from WESA. What is the county's guidance for vaccinated people at large indoor events right now, say a large concert or a crowded club?
I feel a little bit like a broken record. I'm going to say follow the CDC guidance. And the CDC guidance is that if you are not vaccinated, you're in a public place with other people, you should be wearing a mask. And I encourage people to do that. If you are vaccinated, I really think it's your choice, and you should consider your own risk level, and determine if you feel comfortable or not in that position to wear a mask or not. I know that in the past I was asked what I do, and again, I have my own personal decision-making that I make. I am vaccinated, but sometimes when I'm in crowded places, I definitely still wear a mask, and that's my personal choice to do that as a vaccinated person, and I encourage you all to do that as well if you're vaccinated.
That was the final question. If there are any closing remarks.
Well, thank you, Dr. Bogan, and thank you for that good information and you know, trying to obviously synthesize and simplify what recommendations came out yesterday from the CDC. And, you know, all of us are going to continue to work together, and so many folks in this community have worked tirelessly to get people vaccinated, get people safe. As obviously we're about a month away, or maybe just a few weeks away in some school districts, for going back to school. The CDC guidelines are pretty simplified on what they say, everybody in a school, because obviously the kids under the age of 12 aren't eligible right now to get that vaccine. So it is encouraging that over the last day or two we've seen more and more people getting the vaccine. We want that number to really go up and get everybody vaccinated and continue to make this community as safe as could be and get us back to normal. I feel like we've had a nice month of more normalcy that you've seen in community festivals and block parties and just events, workplace, et cetera. We certainly don't want to go back to where we were before then. But the only way to do that is to get everybody vaccinated. So let's continue to encourage all of us to get vaccinated. It's our best path to move forward. It's the best strategy moving forward. So let's continue to be safe and do the things we do to make our community as special and safe as it can be. So we'll be talking to you later, and stay tuned. Thank you.
The next regularly scheduled briefing is Wednesday, August 11th at 4 p.m. Thank you for joining us.